So sorry, I'm sort of struggling with what feels like a little of a disconnect between the morning and the afternoon, and I'm wondering about the phenomena that are under study in the various studies that you guys are doing. So I guess Rich, Vicky, and Milan are working with these longitudinal data, or experience data that are collected in survey mode. Sometimes it's sort of like a TRM kind of report, where the episode is kind of constrained, but not exactly constrained, in which the report of the episode has a number of affects associated with it. Whereas Steve was talking about some very sort of narrowly constrained, I think there were 5-second snippets of the experience. This morning we were struggling with this issue of when is a mixed emotion. There are these things that we're feeling, having these feelings we're having simultaneously. I feel like we get closer to that kind of a notion in the stuff that Steve was talking about, but it's hard to really know what we're talking about in terms of mixed emotion in the daily diary studies, where people are reflecting over an episode that maybe was protracted at the time. And so just conceptually, I wonder what your perspectives are on that. Does it matter for this conversation, or are we talking about a whole variety of things that could be considered mixed emotions, and we should just be clear about which ones are which?
Yeah, well, I'll go first, but so I used examples from daily diary, but when I saw Jeff's talk this morning, I thought that the grid method that you're using would be perfect to be able to study those contour curves. So I could take your data and start estimating those curves, because you've got that somewhat continuous movement as they put their finger on the trackball and sort of move it around right in space. So the methods that I talked about, for me, it was just the examples I used were daily diary, but the formulas would all work. In the same way that this morning we heard about Kaplan and the min measure. I also, and others talked about that min measure this in the afternoon. So, does someone have something to add?
So in the data that we use from the PSID, we ask people to reflect on the whole activity, and like, as you said, to score their emotions for that activity. And I think our interest there was in how people experience not a moment, but sort of their daily lives. And when I conceptualized mixed emotion, it wasn't at the same point in time, but it was that an activity was experienced in multiple ways. And I was more interested in what led to more positive and negative emotions, or less positive and negative emotions, or a mix of them. So what was predicting that, rather than, I think I just defined the concept in different terms than many of the other people in the room. So I do think we may be talking about, there are different definitions floating around. I think that's right. Depending on the purpose, that might be appropriate.
So I think for me, it gets to the timescale issue, and it started with very broad. At the monthly timescale, all of us are experiencing multiple emotions. At the daily timescale, we are. At the hourly timescale, we are. At the 5-second timescale, I think the ratings, they're still providing ratings on 32 items, so they are as well. So at what point does it become pure? That might be even smaller timescales than what we're after. I think another issue there is the ratings system. So like the stuff that Rich was just talking about, there's a 0 to 5 scale. My guess is that the anchor at 0 is not at all. And then it goes a little bit, somewhat, and a lot. And there's a clear 0. Like in smoking research, there's no cigarettes. And so it's a 2-part process in a way. We're in experience sampling, we're getting ratings on 0 to 100 continuous scales, sliders. There's no 0 point anymore. In some cases, it's very hard to get a 0, especially if it's normally distributed. So is there really ever an absence of that emotion, or what is the case when we do not have a mix?
Yeah, and I presented the 5-second version of my talk, which I guess is like an elevator talk, but the 5-second time scale. But I'm actually very interested in the way that the if there's a point in an 8-dimensional space that would describe a mixed emotion, I'm very interested in the evolution within the space. And so that requires, I mean, a 5-second interval is actually a pretty long interval. But I would also like to be able to, and this is, follow-on work, be able to look at, first of all, who the person that is that's listening or speaking when the person that we evaluated, what was the other person in the conversation doing right then? How similar are their emotions? And then, or how similar do other raters perceive their emotions? I mean, there's no real, and in my experience, there's no real ground truth of zero. It's like, what is the emotion? Well, there's communication, and part of communication is hearing. And what do the people hear and perceive? What do they see? That I can tell you about, but I can't really tell you about what was happening in the people's heads as they're conversing. And that, I think, is just really a problem. Whenever we interrupt somebody to ask them a question, or interrupt them to say, okay, so use this slider, now you've got this other context that's happened in between what they remember and what they're doing right now. And so this is why I'm really interested in just these free conversations, so that we can see the evolution of real emotions in time, and hopefully be able to put a probe in there somehow and see how the evolution occurs.
Okay, I have a question for Steve. So in your research, you uncovered that 8-dimensional structure of how we judge emotion in the face. And I thought that was interesting, especially considering that factor analysis has also found that a 2-factor, a circumplex model. And so, the difference between those paradigms, though, is you're looking at the face, and the circumplex model is more interested in our experience of emotion, not the judgment of emotion. And so what I'm wondering, and I wanted your thoughts on, is maybe that those two different things, those are qualitatively different mental processes. The way that we experience emotion is different than the way that we possibly perceive emotion.
And I certainly agree that there's potentially differences in that. I would be shocked if there weren't differences between subjective and perception experiences. Both of them, if we're going to have communication of emotion, both of them have to be active. There's a speaker and a listener, and then we switch roles, and then there's a listener and a speaker. And so there has to be a pretty good correspondence in there someplace. And I don't know how to put the probe in for the subjective experience without changing the subjective experience. It's really hard.
I just want to add one thing, that the 2-factor solution is in a between-person space. And if you go into the within-person space, not every individual follows a 2-factor solution.
If I might do an addition there, and also it's an orthogonal solution. Up to 4 dimensions have been extracted with orthogonal solutions. And after that, people say, well, but it's confusing. Well, as an orthogonal solution, it is confusing. But if you use an oblique solution, all of a sudden it becomes simple. And I think this is something really important.
Okay, I want to follow up on that a little. First, to say that over the last 150 years, the circumplex model has been used for faces, for words, for experiences. So it's a model that never dies, and it's been used for many purposes. And so it's related to the question. I was surprised by how popular the circumplex model was across the charts today, given that that I think there are a lot of problems with it. And I think it certainly makes a difference what adjectives you give the person going in, whether they're going to get 2 dimensions or 8 dimensions or whatever. I could promise that I could do a study next week and get however many dimensions I wanted, depending on what I ask the subjects. So what I want to ask is it sort of a purposeful choice of something to be using a complex model, or is it that it's there?
I'll give an answer. As we moved into the experience sampling studies, we needed to reduce burden. And it was a lot easier at the within-day assessments to ask 2 questions, one valence and one arousal, versus asking 20 emotions. And then what we did is we put people, so we're interested in these dynamics too, of how people move around within the space. And we prioritize the dynamics of movement within a 2-dimensional space versus the structure of the space itself. And it's easy to plot in 2 dimensions. The 8-dimensional thing is harder to plot and communicate.
And the other thing is you can take the 8-dimensional space and project it down onto 2 dimensions. It's not like the 2-dimensional representation isn't there. It's just that it could be richer. And some of what we see, I think, as mixed emotions might just be the projection and loss of information of a higher dimensional space down onto a lower dimension.
No, my problem with 2 dimensions is that it's too general, that I can rate anything in the universe on those 2 dimensions and get a good structure. I can do it for fish, I can do it for cars, and for people. And so what in particular tells us about emotion, I'm not so convinced of.
Well, the way I got to the circumflex was purely by accident. So I started off with positive and negative, right? We separately just measure a positive and measure a negative, and those are the 2 dimensions we start. And then I do a 45-degree rotation, and now I've got the circumflex. Now, or their axes, the bipolar and the whatever the other one, the valence and the arousal, right? So the reason that there's 2 in the circumflex is because we started with just positive and negative. If we had more nuance and said these are the 3 positive and these are the 6 negative, then we wouldn't get the simple circumflex. That's how my thinking kind of went through, and as I prepared the talk. Now it would be great to go through the other theories that you talked about, appraisal, and sort of go through and say, okay, if you start off with the dimensions of appraisal, there are agencies, certainty, valence, I don't remember how many of them there are, but what if we could start, what would everything look like if that was our starting point, rather than just all the positives on one axis and all the negatives on the other? Then that could be interesting, because maybe, new intuitions might emerge from that, from the building an index standpoint.
Excuse me, and also I make no claim that there are 8 dimensions of emotion. I make a claim that the words that we use to describe emotion have a structure. And that's the structure that I'm interested in and describing here.
In mine, we tried to move from the 2-dimensional space onto a lattice, onto a network, in order to warp that space, in order to explain the dynamics, because we cannot get the dynamics to actually play out properly on the 2-dimensional space.
I have a question. This is mostly for Dr. Friedman, but I have to say it's inspired by the idea of mimicking and the way that we interact with each other. I'm interested in the idea that older people who are living with disabilities are experiencing mixed emotions. And I'm also thinking about how members of the general able-bodied population often respond ambivalently toward people who have visible disabilities. So I'm thinking that if somebody has a disability, and this is apparent to people we're interacting with who are presumably blind, then there's this ambivalence that people are treating them with, right? And I'm wondering if that is part of what's uncomfortable about living in a social world with a disability, and are there some disabilities that lead to more of that than others? And, you know, do you understand where I'm going with that question?
I do. I think what we found, though, was that older adults with severe impairments, that leads to negative substitution, which actually I'm not sure that is more mixed emotion. It's actually more negative emotion and pushing out the positive emotion. So maybe the question would be, how do others perceive negative emotions in older adults who have impairments? I mean, if you want to know about the interaction, that might be a question. The other thing to think about, maybe this audience can help me think about, is the fact that the measures of neuroticism seem to be important predictors of negative substitution when someone had a disability or had severe impairments. And it made me think that oftentimes when older adults go to a physician or to a healthcare professional, they fill out quick checklists for the depressive symptoms or for anxiety symptoms, but I'm not sure they're being screened for personality. So, and maybe that's not appropriate to do that. I don't know, maybe this audience has opinions on that, but it seemed like understanding what might trigger poor well-being later in life, this seems to be an important predictor of pushing out positive emotions when you have impairments. I don't have longitudinal data that proves the ordering of when this happens, but if we think of neuroticism as a trait that supposedly is formed earlier in life, perhaps this is something that we might want to think about looking for. So that didn't really answer your question, but when I think about what does this mean in the real world, that's where I go. Thank you.
So I'd like to hear some more comments about there being no defined zero. Or what do people understand when they check off the box that says zero? I did not experience that at all. So for example, in our questionnaires, we have some people who, and of course we're providing them with a limited set of affect or emotions, right? A limited set positive and a limited set negative. We don't ask them anything else to give them the choice to say they were feeling something else. So we assume that it's captured by these limited set. But what happens when somebody checks not at all, not at all, not at all the way down? No, is that, as the survey people would say, it's just like straight lining, they're not motivated? Or is it really that they just didn't experience any of the emotions that we actually asked them about? Or is it that they're interpreting I didn't experience it all as some sort of indication that, well, it wasn't any different than how I normally feel, so they're anchoring it how I normally feel? Or is there some way that we could find out what's going on? Could it be that there's something at a physiological level that could indicate that there was some physiological indicator of a feeling and emotion, but they just didn't tell us about it, right? So this is just brainstorming.
So I think about this as sort of pure balance. I don't know if that's a way to think about it, but if you added up all the scores of all the emotions we did ask people about, who still has zero after we've asked them 5 or 10 emotions? And what does that mean? And in our data, it's very mundane tasks. I was brushing my teeth, so I didn't really feel anything. I mean, it was very mundane, laundry, housework. That's where we saw very low emotion. I don't know if that answers your question, but it's empirically what we saw.
I'll have a go at the question here. Just from because I've been teaching multi-level modeling the last couple of weeks to my students for analyzing diary data, and we typically take our predictor variables and we separate them into within component and between component. And we do that by subtracting out the person-specific mean, which means that we're imposing a theoretical assumption that the mean is the equilibrium point for that person. Whether or not that's correct, we don't really know. If we ask the item, and Rich may know a lot more about this than I do, that if we ask the item, how positive or negative do you feel relative to usual, we get greater intra-individual variability than if we ask the item, how do you feel? And the one issue in the literature is that it's very difficult to get the first item, the pure within-person item published, because multi-level modeling is always looking to separate the within and the between. They want the between component as well.
But I guess I was like jumping multiple steps, right?
Jeff,
If we go to
the mic, so that the people on the TV
So
can
I was like making many leaps. So if you think about the cognitive neuroscience sort of modeling, and they were always comparing against the default condition, you just lie still and your eyes are closed, and there's not supposed to be any activation, right? But now there's so much research going on what's going on in this default, right? This is really interesting, and there are individual differences there, and so is there something that we are also missing by our measurement lines? That's what and this is a real big difference.
The perspective which I was the perspective I was trying to put out, or the idea I was trying to put out, was that is there ever really a resting state of emotion? And, and some theories would say no. Sorry.
Yeah, and this is why we went, in our questionnaire, we went to a statement, and then this is, from very true to very false, because it sort of gives the sense of certainty as well as the the amount, and yeah, I'm not sure if this gets makes the problem go away. No, it doesn't make the problem go away, but I think it does help. It certainly helps with the variance. Our variance was much better than when we started asking, is this person feeling happy? On a scale of 1 to 10. But true or false, and varieties of true and false, that seemed to, evoke people to be thinking harder about the question.
I don't have anything to add over. I also was going to bring up the within person variability in relation to the rush, see the question Monday.
We modeled it that way and it didn't make any difference. It's interesting. The way
So
we did it,
this is maybe a very simple question, but the example of mixed emotion that was given at the beginning of this morning was bittersweet, and you can also recognize what a bittersweet experience is. That's a direct sort of measure. Most of the talks sort of derive mixed emotions from indirectly. Just wondering, can the panel speak to this, or what's the correspondence between our phenomenological understanding of what mixed emotions are and what the data say?
Okay.
To my knowledge, we don't know very much about this calibration question. If you were to ask people directly to rate their mixed emotion experience, right, that's one column of numbers. And then they've also given you positive and negative ratings on different adjectives. We just jumped and we only analyzed the adjectives and try to figure out how to combine them to be able to predict something else. we haven't spent too much time looking at the connection between how well those adjectives map onto the subjective experience. And that's an open question. To my knowledge, I'm not aware of labs that's an active area of research. There might be a paper out there that I don't know about, but it's clearly not in the center of this mixed emotional debate. So I think in some cases people have dismissed this, just asked people directly. And in the attitude ambivalence literature, there was a little bit of attempt of, well, we can ignore the debate of these indices by just asking people directly an ambivalence rating. But I don't know where that literature dropped off at. Do you guys have anything to add?
In our data, we have on average of 7 reports per day, both 5 discrete emotions and valence arousal. And at the end of day level, we have 20 emotions. And I can create a valence arousal composite in the same way that Peter Cuppins creates it out of PA and NA rotating 45 degrees. And I can tell you they do not match. I can't tell you much more than that. A person's own within-day accumulation is not the same as what they experience during the day.
So it's interesting you bring this up because 2 of our emotion adjectives we threw out because they were only mixed. That is to say, they loaded on 3 or more factors. And we said, well, then disappointed, we won't use that as a word. Well, from a factor analytics standpoint, yeah, okay, so that's violates simple structure, so we don't do it. But maybe that should be in there just for exactly that reason.
Interesting.
If I can address this. So with our graduation study at the University of Chicago, we found the graduates reported feeling more bittersweet than non-graduates. But in our move-out case study at Ohio State, we didn't find that moved out reported more bittersweet, even though they did report more mixed emotion patterns. And then I hate to bring this up here. But so we said, well, maybe Ohio State freshmen just don't know what the word means. And so I buried it and said, no, reading. We asked them, each students at each school, to define bittersweet. And yeah, they just really didn't know what it meant. So, yeah, that's it.
That's funny.
In that data set, did you also have positive and negative so that the indices can be created and compared to the actual rating? Have you done that?
I'm sure we did. It didn't. Yeah. So did we see whether people who reported more mixed emotions of happiness also reported feeling more bittersweet? Is that the question?
Right. You have your index of positive and negative you can create. Yeah.
I'm sure we did. I don't. Maybe I didn't look in the paper. I don't recall. I can take a look.
This reminds me of something. We recently spent a day with Daniel Messinger, who has a continuous rating scale system for infants' emotions. So basically, some untrained raters, undergraduate students, watch a video in real time and provide continuous ratings on a continuous scale. One thing that came out of that is that we have all of our facts coding mechanisms, and there are places where they mismatch what it is that the naive raters are rating about the positive negative. And the idea was to use the naive ratings to train a measurement model on how it is that we aggregate together our own codes.
I would love to get some thoughts about what innovative methods, some speculation, we're going to need to bring into this area of research to really get at this vacillation versus simultaneous experience problem. Because of course, you can, as you alluded to, you can keep making the races smaller and smaller, and we still wouldn't necessarily have addressed the issue in that same way. But there are other experiences in psychology that you deal with very quick mental processes. And so I'm just curious, from in your personal input, do you know of methods in other areas of psychology for perhaps cognitive that you have not addressed in your talks so far that could get at this particular issue?
Great question.
Yeah, yeah. We're stumped.
It's hopeless.
Okay. I'll make just one comment. That one thing that we've been thinking about doing, and we haven't done yet, is to try and make the stimuli smaller and smaller in time, so a smaller and smaller time window. At some point, you'll end up with a single frame, you know, and you'd think, well, I'd be back to, you know, Ekman style, you know, single frames. But actually, of course, a happy rated clip may have nothing in it, that no single frame that even looks close to a prototypical happy expression. So it seems to me that probably there is simultaneously information about the dynamics, how the expression is changing, and what the expression is, and we're integrating the two of those in order to come up with perception about that. So my guess is it has something to do with how we're changing from a previous state to a current state, or a current state to a future state, and that contrast gives us the perception, the subjective perception of emotion. It's like, I am angrier than I was just a minute ago.
So just speculating now on this, the biosocial methods lab might be an approach to take, which is to assess this experience of mixed emotions using multiple channels: heart rate, scene response, EEG, eye tracker, facial response, facial coding, facial EMG, etc. And they're, you know, using fancy data mining techniques and data science methods, you might be able to find patterns, small little patterns that are replicable and well predictive of things that we're missing. You know, does the facial muscle switch back and forth from happy to sad, or, you know, the appropriate muscle configuration, or maybe it might be that, that line of thinking basically says, what if we just added more data to the problem, right? Add more types of data, more behavioral data, more physiological data, et cetera. Another way to answer the question is to basically to throw it back and say, maybe it's not really an important question to debate whether it's discrete or continuous, or, you know, the physicist, their analogy there would be with light. You can either think of it as photon, you can think of it as waves. And there are differential predictions, and, you know, one form is sometimes more useful than another, but it's not, they don't debate which one's which, right? It's both. And so how helpful is it to know whether you're switching back and forth from, you know, two different emotions or just one continuous thing?
So, Rich, you touched on reliability and the challenges in trying to assess that. We've had many conversations. I'm just curious about everybody else on the panel. You know, what are your thoughts about the ways to try to approach assessing reliability on some of these measures, where it's not assumed that the score isn't be stationary necessarily?
So I'll totally concur with what Rich said, that the conception of what reliability is needs to be broadened. And I'll phrase it in a slightly different way, is that most of our models have an error term in it, which is the noise term. And we estimate our models by trying to minimize noise, however it is that we've defined what noise is. And there are many possible conceptions of what noise is. So going into some of those zones would be useful.
Yeah, I also, I think I'm saying much the same thing, but I would argue that we really need multivariate measures in order to be able to distinguish between a white noise process, that is to say, a process that is uncorrelated in time as well as uncorrelated across variables, from something that is evolving in time and common across variables. That's really what you want for reliability. And you take this predicted versus unpredicted, or excuse me, predicted versus total variance ratio, and that's what you're trying to do when you get reliability. But you want to get time involved in there, which means that some of that variance has to be predictably changing in time. So you can't ignore time if you want to study variability and have some estimate of how well your measure is doing.
And the time scale.
So I just have a question about terms. It's interesting when we talk about mixed emotions in different contexts. And when I think about social literature, when we talk about a person who elicits both positive and negative emotions, we refer to them as ambivalent ties, right? Ambivalent relationships. But when we talk about the emotions we experience with people, there's positive and negative. We talk about a mixed emotional experience. And I've never ever heard anyone call a mixed emotional day an ambivalent day. And so I'm just wondering what your thoughts are with these mixed emotion experiences when someone describes like a context or a thing as both positive and negative, we call it ambivalent. But when we ask about the emotions in that, with that thing or that context, we call it a mixed experience. Just what are your thoughts about the labels that we're using for these different things?
So one of the things that we found, and the reason that we came up with this disguise or masking set of items, is that we found that some of the clips and some of the items, it wasn't always the same set of items, it wasn't always just some clips. There's like some matching of them produced bimodal distributions in our ratings. Mostly we got really good, inter-rater agreement, but then there were some of these that looked, very different to different people. And so we started to ask, well, is this ambiguity? I mean, it might be that something could be interpreted this way or it could be interpreted that way. Or is it masking? Is it that, I'm trying to show a socially appropriate emotion and feeling something else, and the person who's doing the rating is choosing one or the other to rate. Disguise did not get rid of the bimodal distributions. We put it in there to do that. It took up it was the third largest factor in terms of variance explained, but it didn't get rid of the bimodal distributions. I think ambiguity is about all I can say. I don't have another explanation.
I hadn't thought of this one before. The Shannon's entropy measure, which we used to characterize emotion diversity in the information literature, is a measure of uncertainty. And so maybe that people who have a diverse emotional experience have uncertainty about what there is. And certainly when we did stressor diversity, that was one of the portrayals which we made, was that you're uncertain about what stressor is going to come next. And if you are certain about what stressor is going to come next, then you're in a chronic stress situation, perhaps.
Pick up on Susan's question, because I'm also, so ambivalence is another literature that's been mentioned, and there's an implicit connection here between ambivalence and mixed emotions that I don't fully understand. And I'm wondering, maybe Rich, you can talk about this. Is it simply that this literature, the types of measures for ambivalence are simply being co-opted by emotion researchers, and they're There are, calling it something else. So what actually, putting aside the measurement, the tools of measuring ambivalence, what is the connection between ambivalence and mixed emotions?
I'm somewhat of an outsider to the emotions literature as well as the ambivalence literature, but I share your view that I think they co-opted. So, both literatures measure positive and negative. That's their common point. And so when the emotions people started to think about how to combine positive and negative, they looked at the ambivalence literature because they also were combining positive and negative. And I think the ambivalence people were publishing before the mixed emotions people were publishing. So that's why the order goes in that direction, I think. That's about all that I know. There are other people here who can, yeah.
I'll try to address that a little, but only a little. Ambivalence is a long-term state that actually, when you look at the literature on ambivalent relationships, results from mixed experiences over a relatively long period of time, or personality clashes between two people. And you even find, big differences in families as to which children are viewed ambivalently by the parents and vice versa, for example. Whereas I think mixed emotions are more of a transitory state. Although I think one thing that might connect them is something that James Jackson mentioned this morning, which is that there are relationships or instances when you might expect mixed emotions to be more prevalent. And that would be, say, interacting with someone with whom you have an ambivalent relationship. So you might think of the ambivalence literature as thinking about what produces these relationships, and mixed emotions literature is thinking about how to understand how, if you could take ambivalence as ambivalent relationship as context, they could produce mixed emotions.
So in 1999, I think there was a special section in JPSB on the structure of affect. And so Watson Tullian had a paper, Russell had a paper, and Russell and Meredith had a paper, and then Cassiopo, Gardner, and Bernstein had a paper. And what I was really struck by is that Cassiopo, Bernstein's paper, they were basically pushing the outer space model as if it was a competitor to the Watson and Tullian and Russell. And they were really talking about different things. The outer space model was a model of attitudes. It came out of attitudes, and they explained attitude models. And in my research, I just wanted to see, well, what happens if we try to put the two in the same frame? And so that's, and so of course, I wanted to use different terms in order to highlight that that's what it's trying to do. And I think it's also pointing out that I think it was, I don't know, year 1989 or something, collected a whole bunch of emotion ratings from people who were, they were stuck at an airport waiting for their lost luggage. And you got all this neat data, and he said, these people seem to have mixed emotions, or I don't know what term he used, but he had no idea how to quantify it. He just showed a figure, and it was just, he just didn't know how to quantify mixed emotions. Whereas the attitude literature, told us how to quantify these things. So that's sort of.
Can I add one thing to that? Just the approach avoidance and the framework that I put up was activator inhibitor, and perhaps just trying to go off of the idea of that when the activator and the inhibitor are acting equivalently, then it's a state of ambivalence about which direction it is. So the derivatives are at zero because it doesn't know what direction to go in. Like when my models get stuck and they don't converge.
Just an observation that kind of relates to that is that, and to the point that Rachel was making, sort of speculating on what if we took multiple measures and tried to tackle it from that perspective. Almost everything we talked about today is at the level of the conscious experience of emotional feeling, right? And so, of course, emotions are phenomena at these multiple levels that play out at different time courses. So the action tendency plays out at one time course and the art rate at another. a totally different time course. And so certainly you could have processes competing at one level and resolved at another level at different times. And so I'm not sure that we would get any resolution about mixed emotions at conscious experience level by looking at these other levels. What we might get is that there are other things that potentially could be the target of conscious awareness that might lead us to have a different sort of experience, but I'm not sure that we can answer all those complex answers.
But would one be able to intervene at those other levels?
Certainly, yeah. And interrupt the flow of an emotion, certainly. I mean, I think, you know, so somebody was asking about, well, what other areas of psychology potentially sort of help us resolve this question of oscillating versus simultaneous. And someone earlier mentioned multitasking. I think there's this whole issue of, you know, how does executive control select the one behavioral pattern that we're going to execute. So there's competition at multiple levels, but maybe below the conscious level and below the literacy level that's being resolved at other levels of analysis. And certainly could intervene at any of those levels and change the total output, but I'm not sure if it resolves the question of whether in the conscious experience that we're talking about, we're oscillating or not. Maybe.
Any more questions? How about one tying the morning session with the afternoon session? I know Liz asked that earlier, but is there any other questions about the connection between the 8 speakers today?
This is doing something in church. So summarize for me, the speakers, why are mixed emotions important? I mean, obviously you persuaded NIA to fund this. Knowing the funding situation, I'm impressed, of course. You know, as I listen to it, I found the talks today really interesting and very stimulating. I just wanted seriously from, I would give an answer to the question, but I'd ask it. But I was wondering if maybe every speaker could speak to that. Why is it important to us? People are interested in this.
Does someone from the morning want to take that one?
Well, just to be serious, I think also it's important to the afternoon.
Oh yeah, but to start off.
For me, I'm just interested in mixed emotions and the experience of mixed emotions in particular, just to understand the feelings that we feel. What is it to be a human being and the emotional repertoire that we have? So for me, that phenomenology of it is just something that I find fascinating. Since for me, the mixed emotions of happiness and sadness provide strong tests of these competing theories, which have all been very influential. That's what makes it interesting. After my talks, people often say, okay, so what are the consequences? And yeah, I brought up a couple of papers today, but for me, I say, well, I'll let somebody else deal with that. I'm interested in just the thing itself, and hopefully other people can come along and pick up the ball and find the consequences.
I think you have an excellent question, and I don't really have an answer, so you might wonder why it's microphone. But perhaps one of the questions why I asked about it was because I hear people talking about how diversity is fantastic and allows us to have these functions, but if you're saying the best guess of where we experience mixed emotions are ambivalent relationships, and we know that ambivalent relationships generally don't last, that's not a good summing for mixed emotions. So it's interesting to really think through this. Now, other people have interpreted mixed emotions as more emotionally meaningful experiences, and when I look at people who experience the most stressors in their lives, they're also the people who often experience the most uplifts in their lives. It seemed like when I looked at the emotions people experience when they were with new friends or old friends, these negative emotions were recorded with the people you love the most. You know, there was some type of investment in this experience. And so I do believe that mixed emotions can be, that the infusion of positive in, the infusion of negative in positive experiences can be a symptom that you're really bonded and want to figure something out or want to, that's important to you. And so that's why I think that there's good reason to try to understand this more, but as far as what exactly it means, I think that's real good, excellent question.
So my take on that is I was heavily influenced early in my career by Kurt Lewin and the notions of restraining forces, and whenever you want to change behavior, don't just only focus on reinforcing behavior, but also try to eliminate the negative, the restraining forces. So when I think, I'll give 2 examples. When I think about my parents, if I want to get them to use the computer more, do I make it more attractive in terms of showing them all the stuff they can do in terms of interacting with their grandkids? Or do I focus on removing the frustration, making it easier for them, right? So another case would be a chemo ward. If I want to make the chemo ward more inviting for companions to sit around with the patient while they're sitting in the chemo chair, do I make it more attractive? Do I remove the restraining forces, or both? Right? So for me, that's the kind of theoretical framework that I'm approaching this. And when I hear emotions researchers, some who say there's no such thing as mixed emotions, then I get interested in that. I go, well, clearly it jives with my subjective experience that it's there. Why are theorists who know a lot more about emotions than I do telling me that that's not right? I don't have that experience, or that's not really an experience. It's just made up in my head. And then if I wanted to sort of change things, like the chemo ward or behavior in older adults, having this idea of sort of the positive influences and the negative influences is very useful.
So just a comment on one troubling issue that motivates this concern about how do we conceptualize emotions. So there's been a rush to put measures of subjective well-being or emotions into a lot of large-scale national and international surveys based on some emotional research, using emotional adjectives with the eye to actually influencing policy-making of countries. And the question is, how do we derive an index from people being sampled and asked, are you feeling happy, or being angry, or feeling sad, or feeling frustrated on this given day or this period of time, done in a variety of ways. Extract an index that's meaningful for making any kind of a decision about any kind of policy at the local, institutional, or national level. And so if people's experiences are complex, we want to know about that and we want to be able to quantify that. Secondarily, we'd like to know what sorts of experiences often maximizing or minimizing. This gets to what we're just talking about now. And you have to understand the complexity of people's experiences in order to know that. So these are questions that are sort of driven by activities that are going on at the UK has their Office of National Statistics asking people throughout the country these questions on a regular basis and are trying to use the data to inform their society. For example, put out metrics showing that people who work in this job sector report feeling these kinds of emotions more over time. How should people be interpreting that information and using it to make their decisions? I think it motivates the question. We're asking about NIA's interest as part of the interest. And then it raises very basic questions about measurement and how we can design new surveys to test better ways of putting these measures out.
I want to follow up on that to address your question. There's a study looking at Israeli healthcare workers, hospital workers, very stressful job. And they've looked at the relationships between the balance of positive and negative affect that they experience, and then some sort of subjective well-being outcome. And what they found is an optimal balance, whereby there were some people who seemed to experience too much positive emotion and not enough negative emotion. When you're living, here at Papayana, working in the Raymond Hospital with all the stressors that entails, that's not good for your well-being. On the other hand, if you're just experiencing all the negative emotions and the positive emotions, that's not so good either. There's that optimal balance, there was that curve linear pattern where these people who experience a mix of positive and negative affect seem to have better outcomes.
Just let me say, because I appreciate someone talking to me at the reception, that my question was a genuine one, and actually what the state's done, given my circumstances, something I was working, applying social psychology in a very applied setting, dealing with cancer interactions and everything. I'm persuaded, I had never thought about mixed emotions in that context, but I'm persuaded that that's another avenue that we can explore. And so I'll make it clear that the question is really kind of to summarize, for me, what I thought was the major messages. So I appreciate it.
There was a study or a call from the WHO this week about well-being, with the idea that well-being involves some stabilization process. And to me, when I hear stabilization, I'm thinking there is a complex set of variables that are being played off one with the other. And anytime you have some stabilization process, you are definitely in a mixed situation. This is just, you have to have a mixture of positive and negative forces to stabilize. And so to me, it seems like maybe complex emotions is more of what the way I would describe it. And it's just more realistic than the way that I've heard it described in previous research.
I'll add, just adding to that sentiment, is that if we're interested in doing prediction of people's behavior, we're more likely to find a system that's predictive if we are in multivariate space and in multivariate dynamics than we are if we're in a univariate space. And so it makes sense to move in that direction. And for changing people's behavior, we're trying to identify where the levers are that we can push on in order to do that. And likely those also are multivariate in nature rather than univariate.
There's a question from Twitter.
Oh, okay.
So since everyone went to the trouble of getting us all socially networked.
Are we trending yet?
Nobody else? Yeah. I'm tweeting. That's Harrison over there. So I.
What's that? Who is it? Who is it?
This is Patrick Doyle, PCXC13. Patrick is, let me see, a psych and PR double major and president of APA's Looks Like Your Students Association. So he's a name. Good question. On the issue of phenomenology versus empirical measurement. So the tweet that he's responding to is feeling bittersweet the same as being happy and sad at the same time? And so his question was, I was going to pose a question like that about one of your earlier tweets. When we experience multiple emotions, don't we just combine them into a new feeling? Like melancholy, or nostalgia. So that's Patrick's question.
Yeah, theory person?
Anyone?
Because we always have the problem of words to deal with here, so if you know what the word bittersweet means, it's going to be more likely to apply it. It's a label. I guess the question is there this emergent phenomenon of feeling happy and sad? Is to feel happy and sad, simply to feel happy and sad, or is there something more to it? And yeah, I suspect there is, and it's, yeah, I think that's really the challenge, is you're really trying to get inside the head, and how do people feel, and using the tools of psychology to answer these questions. That's really that's been the fun thing that I've been trying to do. I don't have all the answers.
Is Phoebe still here? Okay. Well, one of the things that she mentioned to me when I invited her to come and give a talk is she said that her position on this sort of debate is a lot like thinking about color. So if you mix, I don't remember now the colors, is it yellow and blue mixed green? And so do you experience green as its own color, or do you experience it as a blending of the two, right? One of the issues is, does it matter if it was blended? If you went out and bought the green paint from Home Depot, or you got blue paint and yellow paint and mixed it yourself? If it's the same shade of green, does it matter how it got there? That's kind of the argument that she kind of, she asked me if that's what she should talk about, and I said, sure, that sounds interesting. Instead, she gave a very nice overview of the four theories in emotions research. But yeah,
So
it's kind of, yeah. Go ahead.
Is the higher order, the sound or whatever, or basically, is that a meta mood? Is that what you mean by a meta mood? Or, I mean, another way I think about it is the working with auditors, and it's very so it's different sounds to go through, and ears and people work together and hear coherent melody, right? There's a shout, but then you can get them to focus on some people, to actually focus on one ear or the other ear, but for the majority of people, it's a discovery that it's the thing that's there, right? So as the blend is the mixture of the shout, but we don't know all of the words for that shout.
Yes, people. Certain kind of people have when we do ask people to describe their emotions, which isn't something that I usually do. It's much easier for me to know what to do with numbers than actual work. Right? But people do seem to have trouble, putting their emotions into words in cases like this. Yeah, because it is this new shelf that we've never experienced before, and it's hard to put it in words.
Can I just raise? Can I raise one thing? Because the original question came from Twitter. Is where are the emoticons themselves sit within this entire conversation? Certainly, emoticons are evolving to capture all kinds of different feelings simultaneously.
Came out with a taco yesterday. Heard it on the news.
All right, well, we're winding down, so I propose that we adjourn for today. There will be hors d'oeuvres up front. And thank you for a very stimulating day.
Thank you.